Nice to meet you.
Nice to meet you.
Thank you. Kazakhstan, first and foremost, is the birthplace of primary healthcare. The big lesson is that no one is safe until everyone is safe. Now we have too many wars. The most important medicine today is peace.
Welcome back to the Astana Times channel. I'm your host, Aseli Stubaldina, and I'm joined today by Dr. Hans Kluge, WHO Regional Director for Europe. Hans, thank you for joining us today and devoting your time to us. First of all, we know that this week the Kazakh capital is hosting two major events, the international conference dedicated to major declarations on primary healthcare and the 73rd session. So could you elaborate on Kazakhstan's role in primary healthcare?
Well, Kazakhstan, first and foremost, is the birthplace of primary healthcare. In 1978, all the countries from all over the world came together to adopt the Alma-Ata Declaration on primary healthcare, which is still very relevant today because we have our health systems under a lot of pressure, and primary healthcare is to be the anchor, the backbone of any health system, to bring healthcare close to the communities where the people are living, where they are working. Primary healthcare can solve 80% of the health problems, also very, very cost effective, so that the hospitals can focus on specialized, complicated care. So what happened on Monday is that 70 countries came together to exchange the innovations, the challenges, and agree on a declaration, what is the way forward. And the beauty was that it was developed by the youth, because 5 years ago, at the birth of the Astana Declaration, we had agreed to see the youth as an equal partner in health and well-being decision-making process. So if we look back, we kept the commitment.
And that's what also the President Tokayev mentioned in his speech about the important role of young people in promoting healthcare in general, right?
We were amazed by the commitment that President Kassym-Jomart Tokayev came himself, telling that primary healthcare, health in general, is really the fundament of a thriving society, of the economy, and that the youth, particularly in Central Asia, where 1 out of 2 persons are almost youth, is really to be taken very seriously.
Just a few days ago, WHO and Kazakhstan signed a new collaborative agreement for the next few years to come. Could you tell us more about what this agreement?
Yes, a collaborative agreement goes both ways. I call it win-win situation. The first aim is to document the innovations happening in the country as an example for the other 52 countries. For example, what Kazakhstan did really amazingly is to have one psychologist in the primary healthcare team for every 5,000 people, because mental health all over the world is a big issue, especially after the lockdowns. So congratulations also on digital health. I mean, amazing innovations. And in return, WHO is also sharing experiences, for example, on healthy lifestyle, chronic diseases. Most of the people pass away prematurely from heart disease, from strokes, from respiratory diseases. So these are some of the issues that we can help each other.
Could you also tell us more about some key discussions and maybe agreements reached during the 73rd session of WHO here in Astana?
Yes, actually I'm quite inspired because just 50 minutes ago, the 53 Ministry of Health approved a historical resolution on the future of the health and care workforce. There is no health without health workforce. I would like to take the advantage to thank all doctors and nurses of Kazakhstan for an amazing job during COVID-19. But now still we have to further encourage them, encourage our young people to become the doctor, to become the nurses. In many countries there is an aging of the workforce, there is migration, the doctors and nurses are migrating to other countries. So this is a global issue. So that's why not one country can address this. And it's so important that all the 50 countries agreed to work together to have a motivated and skilled health workforce.
And since you mentioned the COVID-19 pandemic, we know that it's been 4 years since the pandemic hit the world, killing at least 7 million people, according to the latest estimates. What lessons did WHO and the world in general learn from the pandemic, and how are we now prepared if something like this happens again?
I think the big lesson is that no one is safe until everyone is safe. Because we saw everyone spoke about solidarity, but not all countries did this. There are, for example, a number of countries which has the vaccines, and they kept them for themselves instead of sharing. I really very sincerely have to thank Mr. President here, Minister Dr. Azar Ginyat, for from the very beginning, Kazakhstan has helped a lot of countries, not only vaccines. There was a shortage of masks, there was a shortage of gloves. So this is very important that all countries will support the initiative championed by Dr. Tedros, our WHO Director General, who was also 3 days here, on what we call the pandemic accord, the pandemic agreement, which we hope to agree upon at the World Health Assembly in May next year, on international solidarity, meaning sharing of information, sharing of technology, and also agreeing to accept WHO country missions to see what is really happening, including on the origin of the virus.
And what are your thoughts on the cooperation between WHO and Kazakhstan, and how will it be evolving in the next years?
Kazakhstan really is for us a privileged partner. We do not have only the country office, which we have in many, we have a very special office in Almaty, which is on primary healthcare, which is a center of excellence of WHO for all 53 countries, and we have now agreed last Monday with the countries in the world also to provide assistance to all regions. And this is thanks to the very strong support from Kazakhstan. We're very proud of this. I'm very proud of this as a regional director. And also we're working together on primary healthcare. For example, last year I was myself in Eshinbekshi Kazakh Interdistrict Hospital, where we launched the first WHO demonstration project on primary healthcare, where other countries are coming now to learn what does it mean to have a multidisciplinary team. Because we cannot have any more primary healthcare facilities, only one doctor and one facility. We need to have teams with psychologists, a dietist, with a social worker, and that's one very good example.
So you met President Tokayev just a few days ago in Akorda, and I quote, he said that it is very challenging to be leading the organization like this, like WHO. What have been some of the key challenges that you faced since you assumed your position in 2020?
I think a first challenge has been that we, WHO, stand for equity, health for all. But we have to convince countries. This is a responsibility by the country. So if a country does not want to accept a mission to check the data, or a country does not want to share data, this is a big challenge. So we have to work based on a partnership between all countries, number one. A second challenge is that when I became regional director 3 years ago, there was no any global crisis. Now we have too many wars. Ukraine, Russia, Armenia, Azerbaijan, Israel, which is in my region, and Palestine. So the most important medicine today is peace. If we don't have peace, we cannot achieve good health.
Yes, indeed. Thank you very much, Hans, for joining us today.
Rahmet.